Infirmary West Hospital is shutting down. So what will happen to that building on Gerby Road when Infirmary Health Systems pulls out at the end of the month?
Fox 10 News reporter Renee Dowles has been looking into that question. She joins us live in the studio with the answer. Renee?
Well, the announcement that Infirmary Health Systems is closing its West Mobile Hospital affects another major hospital in our area, the University of South Alabama, which still owns the building. It seems the decision to close Infirmary West has USA scrambling to relocate some of its doctors and their patients who also use the facility.
On October 31st, Infirmary West will become the third hospital to close at this site on Gerby Road. USA bought Knollwood Hospital in 1990. When USA pulled out in 2006, the university leased the hospital to Infirmary Health Systems. 5 USA doctors continue to operate out of the facility. USA Vice President Dr. Ronald Franks says the announcement wasn't a complete surprise.
Well, I was a little bit surprised with the short timeline, but I wasn't totally surprised because they had told us that that was one of the options that they were considering.
Franks says USA doctors and patients will be moved to other USA hospitals in the area. In the meantime, the university is waiting to find out what Infirmary Health Systems plans to do with the building.
It stands now they still have a lease with us, and so if they decide to do something different with the building, they certainly would be talking with us about what their plans are.
Infirmary Health Systems President and CEO Mark Nix blames Obamacare for the decision to close the hospital, but he admits there were other factors.
We have a unique situation at Infirmary West. It's a low-volume hospital to start with. Low volume as far as patients and a low volume as far as emergency room department as well.
Nix indicated Infirmary Health Systems hasn't given up completely on the building.
Our goal would be to try to modify the use of it to try to conform with what we think is best for the community, and that is to have a hospital with some specialized services.
Nix says one priority will be to find jobs for the more than 200 employees at this hospital at other infirmary locations. But it's not just the workers who are concerned about the closing. Elizabeth Martin says she likes living close to a hospital.
I was there for rehab a few years ago, and it was nice to be close to home.
Infirmary Health Systems has a lot of time to figure out how it might utilize the building. Infirmary has 23 years left on its 30-year lease with USA. Now, coming up at 5:30, I'll have some interesting information that may have contributed to the decision to close the hospital, and it's not Obamacare.
Alabama State